morning, Clark. Yep.
Yeah,
we postponed this on Tuesday to Wednesday.
All right, good morning, everyone. We're going to call this meeting to order. We're actually having a special called meeting here to start out of a request from our elections clerk's office, elections department, to consider approval for some postage. And these letters, it's a timing matter because it's letters for voters for redistricting and upcoming election info. So we'll call this meeting to order. I'd ask all of you all to join me in the Pledge of Allegiance. Let us pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. What's that? Ms. Hamilton, will you call the roll, please?
Mr. Hostetler.
present.
Mr. Jones.
Here.
Mr. Wallace.
Here.
Mr. Corman.
Present.
Mr. Ellison.
Here.
Mr. Pratt.
Here.
Mr. Livingston.
Here.
Mr. Culbertson. Sorry.
On behalf of Mr. Gold.
On behalf of Judge Covington.
And present. Thank you all. And thank you for being here, Ben.
My pleasure.
So, with that said, the first item and only item for consideration is approval of $130.10 to BG Integrated Communications for postage. And as I said before, these are letters to voters. Topic is giving out information about redistricting and upcoming election info. Any questions or comments related to that request?
No questions, Judge. Motion.
Motion for Mr. Hostetler.
Second.
I got Kelly Corman with the second. We have Kelly with the second. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. With that said, that concludes the special called meeting. Would there be a motion to adjourn that meeting?
So moved.
Mr. Wallace,
Second.
second for Mr. Jones. Any other questions? All those in favor, please say aye.
Aye.
We are adjourned. Now we will take up our regularly scheduled work session, and we have guests here today. Ian, would you like to start us off with an update on our EMS station construction project, Sheriff's Office construction project, and then the status of our farmers market as well? And you know, Ian's our own, so we got to take it easy on him. He's just bringing facts and data. So we thought it'd be good to share where we're at and then try to answer any questions any of you all have. But Ian, thank you for being here.
No problem, sir. I'm glad I could be here. We'll start with the Sheriff's Office. It's been the longest running, so I'm sure everybody witnessed all the hammering and rock for months and months and months. So that project is running roughly 4 weeks behind. Once they get out of the ground and get get the hollow core pads down and start that first slab, they'll be able to double cruise. So they don't feel they're going to finish that way. They feel they can make all this time up. So right now they're not predicting much movement in the schedule. So we're just working with the sheriff about coordinating that with ending about the same time their tax season starts and whether they're going to move or stay. So we're real cognizant of keeping the contractor on that schedule so that we don't impact their operation at the end of the year. Steel should be going up. I'm going over after this. It wasn't going up last week, but it should be going in now. That'll be holding the hollow core that'll go in over the storm shelters, and they'll get the first floor. Foundations are probably just about complete. So it'll be coming up from the grade level as well as the basement level. And the basement is the majority of the storm shelter reinforcement and work that's kind of taking a long time to reinforce all of that. So it should really pick up and start moving. The EMS is a different story. They don't have any rock. They don't have any good earth over there. So we've got half a building pad established, and they're doing foundations on that. They're been turning dirt in an attempt to dry it. They've gone and done borrows on the site because there's some veining water running basically under a portion of that site that is keeping it wet. So they're turning it, trying to dry it. Of course, the weather's not cooperating with that. We can't stay in the 60s. We can't stay dry. It's supposed to be running all of next week. So in trying to turn it to save money, we're drawing the process out as well. So they're behind schedule and trying to get this pad established. Trying to find that line of where putting rock material in rather than trying to dry the spoils on site is where we're at now. The contractor's requesting just to take it out, set it aside, and build the pads back up with rock. That is talking with the geotechnical engineer with the amount of dirt they're looking at. They're thinking roughly, and this is a real rough number, from $65,000 to $80,000, and that's to keep the project moving and build it back with rock. At some point, we're going to end up crossing those numbers trying to dry the materials and then not have a guarantee that we even get it to a usable consistency at that point. So that is a rough number. It's an unknown number because essentially it's supervised by your geotechnical engineer, and they watch them dig until they get to solid dirt, and then that's where they can build back with rock. So some locations that may be, a few cubic yards, and some that may be hundreds of cubic yards till they get to that. So that number is based on a guess between the contractor and the geotechnical engineer of what they think that will build back. That project itself is probably 4 to 6 weeks behind, with the same intention that once multiple trades can work. Right now, the critical path is getting the building out of the ground, and that's one contractor trying to do one thing. The farmers market, the contractor would start tomorrow, but his concern is he ties the parking lot up, and then the building doesn't come for a while, and people get mad that the parking lot's all fenced up, but nothing's going. So they're trying to tie their schedule to the delivery of the pre-manufactured metal portion, building portion of the structure. That has to go through a design process with the delegated design by their engineers doing the structure and the foundations. So that's the added, for the foundation design, that's the added geotechnical work that happened, I guess, 2 or 3 weeks ago. We're expecting that report in the next week or so. That will get the foundation portions designed and give them that ability to also be working on that. The structure is 9 weeks from the approval of shop drawings. The contractor thought he would have the supplied shop drawings by now. We've got a turnaround time of less than a week to get that going. And when that happens is when they plan on actually physically coming out, starting, so that the building will show up about the time they're ready for it, and there's no lack of work going on, so that the citizens don't get upset that the parking lot's tied up and no work. So
We don't want to do that, but so we're really just waiting on that process, on the shop drawings to be approved, so they can take that 9 weeks to fabricate the metal structure.
correct. And we're waiting to get the shop drawings.
Yeah. So when do you think that we're waiting on some more geotechnical information?
That from the drillings that they did.
The drillings they did.
That was at the request of the foundation designer. So once we have that report, the foundation and the building are two separate.
Yeah.
So the building fabrication is the one that's the most important. The foundation design can be going on during that period, just as long as it's in a time frame that the contractors can get the foundation in at the time the building arrives.
Questions from?
A couple of questions, Judge. You may know this. I just heard this the other day. The farmers market is not going to be down here. I know we had offered between the county attorney's office and where the Justice Center is for that area. Is it correct in saying they're going out to Cardome? That's what I heard.
I don't want to speak for them. I'd heard that as a preliminary possibility.
Okay.
but they're going to be at a different location this
Okay.
summer.
So that will probably help in all
Yeah.
that whole issue.
Yeah, but I think they're going to share that information.
Okay.
But I don't want to. I have heard that that's a preliminary
Okay.
possibility. But really, back to the farmers market,
Yeah.
like the shop drawings getting approved won't happen until that geotechnical work and the engineers looked at that to make sure the foundation.
The building shop drawings are independent of the
Okay.
foundation shop drawings.
All right.
We just need to get those from the supplier,
Yeah.
that's a separate. So in my conversation with the contractor yesterday, they're expecting those in the next 7 to 10 days.
Okay.
So they're pushing on those.
7 to 10 days.
Yeah, I've told my engineers they have a week to get them turned around. So that's normally a 2 to 3 week process, but I've given them a week to get that turned around so that we can expedite that as best as we can. As soon as those are provided, they're correct, and so as soon as those are approved, that's going to start that clock. We get those turned back in, they'll start fabrication, and then the contractor will mobilize, put up the fence, they'll do the curb cut, entrances, and start all that site work, and then hopefully roll into the foundations and get those done, so when the structure shows up, it'll be able to start installing just as soon as it gets here.
Ian, the second question is with the sheriff's office at Great Crossings Park, there's material there. Now, that may be allotted for to be used at the sheriff's office. Can any of that material, I mean, there's a mountain of dirt over there. Can any of that be used at the EMS site? Or, I don't know if the high school site has, you know what I'm saying? Sometimes
Yeah.
they have to pay to get rid of the excess dirt or excess rock. So I didn't know if you all were coordinating between both sides, if that stuff applied.
I think they have gotten rid of all of the waste dirt at the sheriff's office. They spent a good portion of hauling. I think they took it to a couple different sites. JR helped them locate some sites. I don't know if that's can be gotten again, you know. And I don't know the cost difference of borrows and hauling versus just buying a truckload of rock.
Understand.
So, because if it's somewhere, you got to dig it back up.
I
If
get
it's yeah, and it's a good idea, and I don't care to check. I can get with Wilburn and I can get with Marilla and see if there's any options of doing that. I don't know how much of that is left to waste at the high school either. So, but that's a good idea, and it's something to look into. And I'll talk to the geotechnical engineer as well. They'd have to get proctors on any dirt we
Right.
get just to make sure that it can meet the capacities.
And it may not be cost efficient, but if you got material here and you need it here,
It's a good option, and I'll make some phone calls right after the meeting.
okay.
Thank you. And do you think, maybe we've got court again next Friday. Do you think we'll have any, like Wednesday or Thursday, you and I could circle back together, and if we wanted to approve, if we have to use rock, we could approve up to X at court next week as, is that what we need to do to move it along?
It's your all's, however you all are comfortable doing an operation. We were looking at doing it on a time and materials ticket rather than estimates, so that it is what it is. We know how many loads they put in, and we're buying those loads. We're not having them tell us that it's 100 loads, use 80, but we've paid them for 100, because then it's, So the time and materials is when they're only working on that situation, and we're only paying for the product that's being used at that situation. So a maximum rough number would be a good process, with the intention of obviously coming under that, but that's.
Well, let's me and you circle back up Wednesday and see where we're at, and we'll make a recommendation to the court.
Okay.
So on that same issue, there wouldn't be any labor involved, right? They got to move the material anyhow. It's just going to be the rock and the delivery.
There will be, there's placement and compaction, and there'll be additional testing. The testing agent has to observe the lifts of coming up to make sure it all, because with dealing with the rock, if we did 5 feet of rock, they can get the top bound to where it's doing bearing, but the bottom maybe didn't. So they have to bring it up and lift. So there's still some labor in there.
Rob Jones.
Did you say there was a spring or something under part of the building?
That's a drainage swale at that property, and we're obviously trying to stay away from a good portion of it. but there is a lot of water that apparently is coming down through there and rolling, so when they were digging, they were actually seeing moving water. I don't think it was a spring as much as it is just the drainage going
So
there.
it's something we don't need to be concerned with?
No, the geotech is comfortable with it, so.
And then as far as all the rock, wasn't the geotech surveys before we started this project, when they have found out we needed all that rock? So that it could have been put in a contract instead of making change
Well,
orders?
I think it's just because of weather conditions as much as anything that,
A lot of it, I mean, you can classify types of materials and try to do that. One of the things that you end up with is guesses. They're going to guess to protect themselves, and that usually will burn the client because they're going to pad that bid. Running into it and doing it this way, we're only paying for what they are doing for that specific and not a guess. So up front, you just don't know, again, because it's the testing agent that says, yes, you've reached good soil, you can build up from that. Or no, keep going until you do it. So that ends up not being a good bid process. A lot of times that just by itself forces things to be overbid because people are just taking a guess that we're going to need 2 feet of rock across the entire pad, and they only may need it in one corner, but you bought 2 feet of rock.
So the pad, it seems pretty low to me right now, so that rock will build that pad up. Is that what you're trying to say, or
No,
just for the footer?
one half of the building, if you're looking at the side as you're driving by, the right half of that building is there. That pad is there. It's the left half where it actually drops down into that swale. That left half is what they're having trouble getting built up.
but if we'd done this in August, if we'd waited till August, the chance of not having to deal with wet dirt would have been much better.
Correct.
It's just as much a timing as a geotechnical aspect as well, so.
So just a question, just so I know,
Yeah.
I always get the plans after all this is done, but so they could have just moved the dirt over and packed it in, and that would have brought it all up. Is that?
If they trying to use the materials on site, what they did is they over excavated the wet areas, put it aside. They went back to a dry area or drier area that passed Proctor. They're trying to get it dry enough to actually build the pad back to.
Okay.
Problem is they can't get it to dry in the condition. At some point, the labor of turning and playing with that dirt is going to pass what it would cost to do the rock.
Last question.
A lot of moving pieces.
Yeah, back on the SO, I know you talked about the 4 weeks and timeline with the wetness. What is the projected, we're not going to hold you to that. We understand there's issues, but the projected completion month?
They're looking at September, October.
Yeah.
Okay.
They're trying, which is right when the sheriff's
Yeah, and
tax
elections,
season
we got
starts.
election. I don't know if they were going
Right.
to use that. Yeah, so we'll have to coordinate all that.
But that's what they're shooting for, and they're trying to not lose any time based off of that by planning to condense some of the work with multiple crews once they're standing on a slab instead of trying to build the slab.
Any other questions? Ian, thank you for coming.
No problem, sir.
Appreciate your time.
You guys have a good one.
We'll move next. We have a presentation, a little information from Brandon Rimley with our EMS, our community paramedicine provider. And glad you're here. Appreciate your time.
Good morning, Judge, Magistrates. Thank you so much. Nice to see a lot of familiar faces again. So Chris wanted me to come up and just kind of give you guys a brief rundown of what's been going on with the community paramedicine program. Of course, I was hired in September, and we got the program up and running really in December. A few months of just kind of putting protocols together on how we were going to do things, spending some time making collaborations throughout the community. So my first patient I enrolled on December 10th. Since that time, I've actually had 30 referrals to the program. I know that number seems small, but with that 30 referrals, we've had, I've performed 109 home visits. Most of these home visits usually take anywhere from an hour to an hour and a half. I sit down, I spend a lot of time with the individual finding out what the true cause of their conditions are, reasons why we have to, sometimes make multiple visits to the residents. And then, once again, it's a lot of just communication, trying to get them the resources that they need. So with those 30 referrals that I've had, 6 of those have been mental health patients. 10 have been referred to the program due to multiple falls at the residence, and 14 have chronic medical conditions. So it could be diabetes, heart conditions, and so forth. With that being said, like some of the things that we refer these individuals to, I've made 3 referrals after going in and visiting with them, kind of decided that, hey, maybe some PT would work, consulted with their primary care physician, and have set up PT in the home for these individuals. 3 have referred out to mental health services, that they did not have any mental health services being provided to them, so I got them connected to that. We've connected patients with hospice care, and even made connections. Individuals, the reason why they were using 911 and using the ER is because they didn't have a primary care. They've called offices and they said, we don't take your insurance, so they just gave up. So it's working with them, trying to get them connected to what they need. Some of the individuals, just the age range, the youngest individual I've worked with has been 19 years of age, all the way up to 84. The majority of the individuals in the program are between 60 and 80 years of age. Just a couple success stories. One individual we made 7 calls on in a 2-week period. After sitting down, it was a patient with mental health issues, connected them with the resources that they needed, and since that time, we've had no additional responses to that residence. Somebody I followed up with a month after we got them connected, but it was just that simple of they didn't know where to turn to, they didn't know where to get their resources, they were calling 911, going to the ER, and they were getting just quick treatments in the emergency room and then being sent back home, and it was not fixing their underlying issues. Another kind of success story that is still in process, from the end of November to January, we had an individual that called 23 times. And the way that they were calling it into the 911 system, it required a multi-agency response. That would include us, fire department, law enforcement. Once again, sitting down with this individual, kind of finding the root cause. Since February, we've had no responses to the residents. And still working with a lot of these individuals, but it's getting them the resources that they need. So while the numbers seem small, we are having some success. It is ultimately saving wear and tear on vehicles, not only for us, but other agencies in which we work with. And overall, the biggest thing is we are getting patients connected to the resources that they need to get them in a better medical condition.
I think those are really big numbers to me. I mean, I think you're underselling and understating it. I applaud your efforts, and the impact, the domino effect is your efforts are making sure that our other resources are being used more effectively.
Correct.
Can you say that last one you were talking about was 20 sometimes?
23 times, and basically
I think that's a big number.
2-month period, So
David Livingston.
Yeah, I was going to ask, and this might be something Chris may need to look into, but if possible, do we have an idea of how much a run costs?
Actually, I don't know. We've got that information. I don't know if you have it with you, but it's something we can definitely get.
Okay,
Mm-hmm.
I'd be really curious about that, because that would,
I think you could
start
follow up with that
figuring
next week
that
or so.
out.
A good
Thank you.
piece of data.
So, of course, the other aspect of my position is working with those who have addiction issues, substance abuse issues. So primary focus, of course, is our opioid users. And just to kind of give you a brief rundown, so far this year, our agency has responded to 25 overdoses, and we've had to use Narcan 14 times. Now, you probably notice a little bit of difference in the Narcan use compared to individuals, but a lot of that is because Narcan is being more available to individuals out in the community. I collaborate a lot with the recovery team over at the Georgetown Police Department. They've been together for a few years. They have a lot of great respect in the community and so forth, so we work very closely together. So out of those 25 that we've had thus far this year, 19 of those are males, 6 were females, and the age ranges go from 15 years of age up to 64. Kind of the sad part of this is thus far this year, we've already had 7 confirmed overdose deaths. That information was provided through Mr. Sutton's office.
And that's from January 1.
From January 1 up until 3/25, it was 7 confirmed overdose deaths.
That trend's higher, I believe.
Yeah, so so just to kind of give you, going to the death part, last year's total for 2023 was 17. 2022 was 8 total for the entire year. 21 was 33, and in 2020 was 41 deaths. So hopefully we can continue to keep those numbers down, but only being 3 months into the year, unfortunately we are afraid that those numbers will continue to decline. Just a little, just to kind of once again kind of touch on those overdose numbers, to kind of let you know where we stand. As I mentioned, we've already treated 25 patients thus far this year. That number kind of reflects back to 2020. At this same time period in 2020, we had treated 20 patients. And then last year, same time frame was 46. 22 was also 46, and then 21 was 49 patients. So I do believe that having the Narcan available, more people using it, or having it available for their families to administer, I think that could be a contributing reason why our numbers are a little bit lower, which is a good thing. But it's still a battle that we have in this community, and we'll keep fighting to see what we can do. As I mentioned, part of this is once our crews do respond out to these overdoses, I receive the information, and then I collaborate with the team over at Georgetown Police Department, and we try to go out and do a follow-up within 24 to 72 hours after that overdose, providing them resources on treatment programs and also providing them the Narcan.
Brandon, are you tracking those? So it's quantitative when these people made these many 911 calls in this time frame. Mm-hmm. Are you tracking the folks that are ODing that you all are meeting with? Mm-hmm. That you're giving them information? Are they going to Shepherd's House? Are they going to the recovery program, the Angel program that they have?
Sure.
Georgetown PD.
So I don't track that information. Like I said, I collaborate a lot with Corey and Jason and Patrick over the PD. Corey does track all of that information. So if you do need that, I can definitely get that for you. But I will tell you, most of the time we go, we knock on the door, we provide them the information. Most of the individuals are very open and welcome to hearing what we have to say. It's just, individuals have to be determined that they want to seek treatment and they want to go into a treatment program. I do know a couple of weeks ago that they knocked on a door 24 hours after we had made a response, and they kind of told them about why they were there, and the individual says, "I need help. Can I go today?" And they said, "Sure." They took him with them, went over to PD, found him a treatment program, and within, I think it was 2 hours, they had him into a facility to receive treatment. Those are the success stories we want to hear, but those are very far and few. Once again, it has to be that individual. They have to be ready to go into those treatment programs. Yeah.
So when we also have the Isaiah House here as well, as I'm sure you're aware of.
Right.
But I keep thinking about this net device that we've signed on with. Those folks would have been, as the net device people told us, if they get that program up and running, those people would be candidates, because it sounds like they are actively in addiction, and that's when the device works. But that program's not up and running. But I was wondering also, do people have trouble with like methadone or Suboxone? Do they OD on that? That's just a...
Yeah. So I do kind of, or one of the things since I have developed, kind of come in and started tracking a lot of this, I try to get my crews to ask the patients if they know what they took. I would say about 75% of the time we'll get a response from the patient. They'll tell us, then unfortunately a lot of times patients say, I didn't take anything, which we know was false. But most of the time they'll tell us that it was heroin, it was fentanyl, or, hey, I thought I was taking a certain substance, but apparently it wasn't what I thought I was taking. We do get a lot of that, and so forth. So, yeah.
But like, I really think it's meaningful, and like it's only going to, grow in its impact, in my opinion. And like helping one person get off drugs and maybe get back to productive life. I mean, I'll take every win we get, and I appreciate what you're doing. And I'm like Rick, it'd be great, and Chad as well, if we could, try to connect them with Isaiah House, Shepherd's House, and then try to see, where are they at in 6 weeks? Where are they at in 3 months? But I know it's very difficult, and it takes time. But we'll take these steps right now. I think it's a success, and I think it's real positive. Yeah. Questions or comments, and anything else?
But just one more comment to add to what you're saying. Part of Brandon's position is paid for out of the opioid settlement money. So I think it's a win-win. Every tool we're using, and this is one of them, and especially with the folks, even though it's not opioid involved, like the first set of patients you were talking about, I don't think that was their issue. Yeah. But these ones with the opioid use problems, it's still a win. You want to knock on the door, and every time they say, I want treatment. But we've already heard from all that we've heard from the net device folks, the biggest deal that stops people is withdrawals. But hopefully that person, I don't know if it's a guy or a gal, but hopefully that person sticks with that program that they got connected to. That's awesome. It is a win-win. So
thank you very much.
Thank you. Appreciate your time.
Chris?
Yeah, I just wanted to add a word. Brandon, of course, being modest as usual, but he's out there in the community actually going to pharmacies and getting prescriptions and taking these individuals if they don't have transportation. He's going out and physically picking them up and taking them to their doctor's appointments that they otherwise wouldn't be going to. So I think the impact is just huge in the community. He's definitely the most popular guy in our building. He's cut down on the 911 responses significantly, especially those repeat folks that we're going out, like he said, 23 times. We had that one individual, we didn't respond like 60 times in a year's time. So he's just making a huge difference, and I just wanted to chime in and let you guys know the impact is real in our community. He's helped folks without insurance get insurance. His phone rings off the hook. He was arguing back and forth for a couple of weeks with Medicaid to get a woman some insurance coverage, and was successful. So,
man, it makes me very excited that we've implemented this, and we got a great person that's got the demeanor and the servant's heart to go out there and help people and go above and beyond. And
we're still working with the hospital. We haven't even got involved in that side to do their follow-ups. There's been some hiccups with their legal team not wanting to share those protected PHI, protected health care information with Brandon. But they do it a lot of other places. So once that kicks in, his workload will probably triple.
Well,
yeah, I'd be really curious about, because I think it's important that, did you say 7 runs or however many runs in so many days? I mean, not only the wear and tear on the equipment, the wear and tear and the mental stress on the EMS people, but the actual cost savings because sometimes that's all people look at is the cost savings.
Yeah, and a lot.
What about the homeless drug addicts? Are you able to find them? Like one particular woman I know that's addicted was living in a car in Walmart parking lot. Like, would you go to those places if you know where they're staying?
So with that, I work with Heather over at the Gathering Place. I'm also very actively working with Candace, who is working on our, affordable housing project here in Scott County. So, I was part of when we did our homeless count, went out with them. So, and I have met several individuals. One of the things that I kind of also do is both Serena over at the Amen House, Heather has my personal contact information. If they have individuals that come in that they think, hey, they really need medical attention, but we know that they will not go to the hospital, they'll call me. They'll get those individuals to hang out. I'll go do an evaluation and then kind of give my personal opinion of, hey, let's either take you over to the urgent treatment center or take you to the emergency department and get these issues treated. So we are making contact with them. We, as far as overdose within our unhoused population, we have had a few, but probably not as many as most communities do. We do recognize that there are some that use, but there are other individuals that are unhoused for other reasons, and they are not users or have addiction issues. So we try to work with them, try to give them the resources that they need to get them back on their feet. So.
Yeah, and one last thing I just want to mention, we have budgeted for some software in the upcoming year that Brandon will be able to utilize. And it's kind of like spokes on a wheel. It goes out to all the food pantries, all the homeless shelters, all the addiction folks. And if he goes, visits a home and sees a need, he can just put that in there and it'll automatically go to those places. So if somebody needs food, all the food pantries will be notified just from a text from him. And then whoever responds first to that and says, hey, we'll take care of it, then it notifies everybody else that the issue's been taken care of. So I think that's going to be a huge resource for us too, if we can get that in place. And it will free of charge to any end user. They can sign up on that software. So we're looking forward to that. I think it would streamline a lot of things too.
Very good.
Thank you.
Thank you all. Anybody?
Do you have and maybe David, it's for them, maybe David or you, there was the law that was proposed in the state that they were going to make homelessness a crime, and then, if it was a crime.
Not homelessness.
Okay.
Trespassing.
Okay.
There's a difference.
Okay.
But to my knowledge, that did not go through.
Well, Senate bill, was that Senate Bill 2? House Bill 5?
Yeah.
I don't know how it went through. It did pass because there's they're predicting that there was $1 billion price tag to it. But I don't know what stayed in there.
Well, the question is if there was an issue, would the jail medical staff be dealing with this versus EMS? And that was really the ultimate question.
If they took them to jail?
Yeah.
Yeah.
Okay. All right.
Well, try to do a little catch up on that, but I'm not sure. But, along those lines, April 1st, I believe, was the day, Michelle, that our 24-hour, our change in medical coverage at the jail went into effect. It's not 24/7. It's 7 days a week with 12 hours, I think is right. Yeah. So that's a positive thing as well. So along the lines, Chris mentioned budgets. So this coming week, we're actually having some initial budget request review meetings on Wednesday and Thursday. We're setting as a target for first reading May 23rd, second reading June 4th. If we finish up quicker, which we probably won't, June 14th, I'm sorry. I apologize. May 23rd, first reading. June 14th would be a second reading. If we finish up before then and we feel comfortable, then we might be able to move that up. But that's kind of our targets, and we'll be sharing information with the court. This is, in my opinion, it's constitutionally the most important thing that we do, and I think we have demonstrated it year after year of being good stewards of tax dollars, but also addressing needs now and addressing needs in the future down the road, and that's evident with our capital projects that we're doing with EMS, Sheriff's Office, Clerk's Annex, all those different projects that we're doing. So, just giving you an update on that. There will be a reminder that on April 16th, there'll be an interlocal committee meeting at 4 o'clock right here in this room.
What's the date?
April 16th. We're having the airport board representation here just to give us an update on the airport.
What time? Sorry.
4 o'clock. Code enforcement, we've got a little interlocal cleanup in the language we need to do, and it's all tied to if there is a lawsuit resulting from an abatement or action, who actually pays for that legal representation and navigating through that. If it happens in the city city would pay for it. If it happens out in the county, the county would pay.
You want to explain that a little bit more? Why?
Just we're trying to clean up that language in that interlocal.
Yeah, well, the reason is because CAECO covers that through a planning and zoning endorsement in the policy. KLC does not. The reason is because most cities have their own planning and zoning where ours is interlocal. So when there's a lawsuit that names us and names the city, we have coverage, but the city does not.
So we're going to try to clean that up, and we'll talk about that. Another interesting topic because of medical marijuana and legislation related to that. There has to be some local plans about where it is appropriate to dispense that and how it's dispensed and times and locations. So that's going to have to be a topic of discussion as we move forward.
Can we have mobile trucks? I was asked by a constituent.
I would venture to say
Just
no. I will vote no on that. But this is all related to medical marijuana.
Brandon can deliver it.
Yeah. He will really become popular. Oh. So with that said, that's interlocal, and then also policy for road ownership that Dr. Wallace had talked about previously when we discussed annexation. At what point does the city take over maintenance for roads? So that's a topic as well. And then do want to trying to schedule a little ribbon cutting at the Lyle Road Soccer Complex on a Saturday morning here in April, late April, in between games, and it would simply be, just right there at the concession stand bathroom we built. It really looks nice out there. I was out there a week ago on a Wednesday night or a Thursday night. There were 500 people out there, kids, parents, everywhere, and just really using the facility. And then with the Legacy Trail project moving forward, not as fast as we wish it would, but that will be a hub for recreation. It's just going to be it's very nice, and I think it's only going to get better. Any questions about that? I'll try to update you on that as quick as I can. The state legislature has 2 more days that I think they come back on the 12th for veto override days, and then they close out. But there's a lot of good things that have happened out of this session, and the biennial highway construction plan has some good money in there for Scott County that will impact our community, and one of them we've talked quite a bit about is out on Paynes Depot and Leestown. There's money in there to actually construct what they call a peanut roundabout, and then 460 connector roads in there, and just a lot of good things. I wanted to mention that as well. Does anybody else have anything for the group? Yes, sir.
Did you say that interlocal was at 4 p.m.?
I believe
16th?
I think it's 4 o'clock. Can you check on this?
Here?
Yes.
Yeah. And also, I was at the last one we had, and I'm just wondering, I brought it up, but also City Councilman was here too about potentially privatizing electrical inspections. I don't know if you've given any more thought to that or.
I have not, but if that's something you want to pursue, we can certainly lay the facts and data out there and bring it to a vote.
I can gather you some facts.
Yeah. I will say publicly, though, I have not had, at one time we had some concern about, just some issues related to interaction with staff. I've not had, in 4 or 5 months, I've not had any negative feedback. I will share that. I'm sure that, whenever you're out there, you're never going to make everybody happy, but we did have some of that. We addressed that. I've not had any negative feedback calls in 4 or 5 months. But we'll ask Michelle to pull up data about, what expenses have been and then what revenues have been, try to lay it out and look at it over 2 or 3 years, and let's talk about it, and then let's deal with it.
Yeah, that's what I was looking for, just running those numbers, like you just said. That was the big thing.
We had back in 11, 12, 13, when we were coming out of the recession, there was a lot of conversation about privatizing it because at the time it was running in the red. And so the last 2 or 3 years, I'm pretty sure it's not going to be running in the red.
Yeah, she's got it.
Yeah. I mean, because it's just when everything slows down, when the economy slows down, is when it runs in the red, and we pushed, myself and a couple other people pushed at that time to do it, and there was no appetite for it at the time.
Well, through my time on the court, I've gotten complaints that the judge, I think, is talking about on some issues. And I still hear those, by the way, from folks that work in Fayette County, electrical contractors, there's multiple reasons, I'm sure, but some of them won't come to Scott County.
I've got a friend that he's electrical contractor, does solar also, and he won't come to Scott County anymore.
And so, that's an issue. But the big deal is in my view, and I don't know the numbers, but I think we're going to get them, is it's what goes on in Fayette County and several surrounding counties. It's no cost to those counties.
That's what I'd like to know is what other counties are doing, and not just around
Fayette
us.
County's
But,
doing it, Madison.
What's Hardin County doing? What's Boone, Kenton, Campbell? What do they do? Madison. Can you have it ready by the 16th?
Yeah, most inspectors now are independent of the counties or the city they're working for. So I think we're probably a rare breed anymore. But I was going to say, according to my bills, they're through the roof. We should have plenty of money in the electrical inspections.
Judge, can you give us an update?
Chris Runyon had wanted to address the court, and then I'll come back to you.
Yeah, I meant to mention this earlier. I just wanted the court to know, I don't know if everybody heard, but in Somerset, there was an EMT and a patient killed in a motor vehicle collision. We're sending a couple trucks and some personnel down Friday evening and Saturday day to cover for the visitation and the funeral. Yeah, tonight. So the folks that work there can attend the services. So if you hear or see that we got a truck way out of our district, I just wanted the court to be aware that that's what's going on.
No, thank you for doing that.
Can you give us an update on the Hall of Justice?
The Hall of Justice.
And your super friends.
Yeah.
So I'm praying daily that next Thursday we will be able to putting the project out to bid. There is one hiccup about family court room sizes, and we're discussing that on Thursday. But I'm going to do everything I can to vote and get that to vote to put it out to bid on Thursday next week. We've got to follow AOC guidelines, AP Part 10 guidelines, in the process, and it's just been a slow process.
And it's a 60-day bid or a 30-day bid?
I think it's 60 days.
Okay.
And we'll finalize that on Thursday, but it won't be 30 days. It'll be more like 45 to 60, I think.
So the work that's going on here that's Columbia Gas doing.
Columbia Gas doing infrastructure upgrades that were needed, but I think it's also addressing knowing that's going in there as well.
Yeah.
They've been out there doing a lot.
Yeah. Thank you.
Yes. David Livingston.
If you all don't mind, even the people sitting in the audience, there is a presidential scholarship from CAECO that is free money. So if you are a senior at Phoenix, Great Crossing, or Scott County, please have the seniors go apply for it. You've got to be going to school in Kentucky, but it can be a 2-year technical school, or it can be a 4-year full bachelor's degree. Either way. So it's free money. It's a big scholarship. It's for 2 or for 4 years, depending on what you're doing. It closes on the 10th, I believe. So this is a one-time opportunity we're going to have because it's only the president of CAECO that gets it in their county.
Hold up now. Hold up. There might be a future president of CAECO sometime down the road from Scott County.
No, I know their qualifications.
I'm just giving you a hard time.
No, everybody's seen what I have to go through. Nobody wants to do it. No, I'm kidding. But I would. Applications are thin, and that's what I don't understand. Is like
I've done a reference and a recommendation for one.
Yeah, I mean it's very simple, and my kid can't win, which I think is crap. But we get it here because I'm serving as president, but then my child cannot win.
Yeah.
And it is. I do not participate in the selection process. It is kind of a blind situation where they go through all the qualifications, the references, and all that, and then they match up the name with the application, and
it's a great scholarship.
And then they tell me who it is.
It's a great scholarship, and then the people that will review the applications, they actually are other county officials from other jurisdictions. And CAECO at the last executive board meeting, they placed those. There's three individuals and one alternate. So that's been, that's who will be reviewing the applications.
So
anything else?
I cannot do you a favor and pick your child.
Yeah. Rob Jones.
The parking lot issues.
I have not heard anything from the city about when they're going to start that process of installing that parking lot. I'll check with them and try to give you all an update. Good question. Mr. Hostetler.
Just a reminder, the Not Alone Pregnancy fundraising banquet is next Friday. I think I probably haven't hit everybody, but if you haven't gotten an invitation, let me know and I'll send you the flyer. But just I know I've hit all the court and several people I see sitting here, so.
Right.
But that's closing in on us fast.
All right. Thank you for that update. Well, if there's no other business, nothing else from anyone on the court, we will conclude our work session and appreciate your time and have a safe weekend. Thank you all.